I'd like to talk to you today about what to do next once you've decided that the client that you're seeing would be a good candidate for AcuDestress. These clients present a particular difficulty. If you think that they're going to be candidates for AcuDestress, you're also making a decision that they're not functioning very well. What you'll find out if they have to do anything complex, is that you'll be further surprised because they will be even less functional than you think. Particularly those patients who are struggling with gluten sensitivity, which throws them right off and gives them what even they describe as brain fog, which really means that they can't think, they can't ostensibly think through the steps to do much of what's required in life. I realized this even more so in the last 5 years when we started getting people who had to leave the workforce because they were just not functional anymore. And particularly this showed up in people who use computers. What would happen typically is that they would notice that they weren't keeping up with their colleagues, that they, that everybody else was moving faster than them, that they would read something and they wouldn't understand it. So really, even more than just the emotional and mental effects of chronic stress, there's also the cognitive effects. And this is what you're going to come up against if you don't keep it simple with these folks. I had the occasion recently, because I had a small group of patients, to watch what happened in the early stages of treatment when, for particular reasons, we had to change some dates, we had to change some times, and this was very confusing to our patients. It seemed to us that, okay, we carefully explained it to them, we carefully told them all the details, and we'd have them coming back the next day asking us to repeat it or telling us that they couldn't remember what we'd said, or actually coming at the wrong time, all sorts of things that you wouldn't really expect to happen. I would like you to know that how important it is to make the referral a one-step process. What I'd really like you to do is, if you think that they would be good to see me, and I can usually explain to them enough that they'll be able to decide whether to come or not. You kind of have to take them by the hand. When they leave your office, they should go to whoever normally books appointments for them, and they should book an appointment. Maybe you should come out with them to say a few words to the booking person. They should leave with a brochure so that they know that they can make a phone call if there's anything that they're confused about, because there will be. And you should never have them have to make a follow-up by going on a computer or calling in or doing something more complex. Everything should be provided for them in the first step. That goes for playing telephone tag with them too, because often you'll find that they don't answer their call, but they not only don't answer, they never answer it. We're dealing with people who have a lot to gain with AcuDestress because this will go away. But at the beginning, it could become very difficult for you if you interject or inject too much complexity in the situation. My suggestion, keep it real simple.